And we will have a talk of two speakers, Dr. Manchanda and Dr. Anil Khurana, who will talk about the homeopathy in the health system in India. Both speakers, I think I don't have to introduce them very much, have an enormous experience and know-how related to homeopathy research in actually all fields. And due to their positions in the past and also recently, they were able to support homeopathy in India. Dr. Manchanda is chairman of the Drug Technical Advisory Board of the government in India, as also as the director of the Central Council for Homeopathy Research under the Ministry of Ayush, and Dr. Khurana as the Deputy Director of the Central Council for Homeopathy Research. I'm very pleased to have this honor to introduce you, and I'm very curious about your lecture. The floor is yours.
So I hope my screen is visible.
Yes.
So first of all, thank you, Carla, and thank you, Olga. So I would just like to tell you the current position of mine and Anil Khurana at the beginning, because you just told about this position that was about few years back when we visited Rio de Janeiro. Anil visited, and then I also visited your university. Currently, I am Director of Ayush at Government of Delhi, and Dr. Khurana is not only Director General of Central Council for Research in Homeopathy, but is also Chairman of National Commission of Homeopathy, an apex body that looks after homeopathic education in India. So this is our current position. I think our current biodatas were not available with you. Anyway, it's okay. So today I will be sharing with you the integration of homeopathy in the healthcare systems and services in India, what is going on in India and how it can be helpful for rest of the world. So I'll be covering broadly about the historical aspect, little bit of policies, then touching about the institutionalization of homeopathy in practice, research and education, and our international collaboration. And then I'll be coming to in international collaboration, how we are working in hand with LMHI. So as regard India is concerned, it is a very multicultural, multilinguistic, democratic country. We have many languages like Brazil, lot of diversity is there. And our key is unity in diversity. Our beliefs are very different. Our languages are very different, but we all are united. So it's a very unique country in the globe. And here, medical pluralism is very, very important factor in healthcare systems. People adopt health services according to their beliefs, experience, monetary status, and accessibility. And government on their part follows cafeteria approach. They try to provide all recognized system in public health system. Although it is very, very challenging for policymaker to provide all types of systems under one roof. But what we have seen in India, it is viable and it is very, very rewarding in the health services. So in India, we have parallel ministry of Ayush that look after Ayurveda, yoga, naturopathy, Unani, Siddha, and homeopathy. This ministry is parallel to the main health ministry and has been recently established. Here we give equal status to all the doctors of all the systems. We have separate research council, statutory commissions to look after quality of education in the country, and we have model national institutes in different parts of the countries, in different systems. And in our Drug and Cosmetic Act, like in Brazil, we have special provision for homeopathy. We have separate homeopathic pharmacopoeia of India, and we also give respect to all other international pharmacopoeias of homeopathy. So this is how homeopathy is fully integrated and institutionalized at all levels. So this is about central government. Similarly, in all the 34, 35 states of India, homeopathy and all Ayush systems have separate directorate. Like earlier, I was on deputation with Government of India, but now I am looking after all the Ayush systems in Delhi. We follow WHO traditional medicine strategy. Our national policies are based on this strategy that says that we need to provide all traditional systems at primary healthcare level. Our focus is to provide all Ayush systems at primary healthcare level. And patient can have a choice of using one system at a time, two systems at a time, as per their requirement and as per the need. And there is a lot of inter-system transfer of patient also. Our education is university affiliated education. We have more than now 250 homeopathic medical colleges and in the country, in different states, and they constitute almost 30% of all the colleges. We have an organized system where 5.5 years of training is being given, teaching as well as practical training. Apart from that, and only science student can take admission in these colleges. In addition to that, we have MD program and PhD programs in homeopathy. And this type of structure is being followed by other countries like South Africa, Bangladesh, Nepal, Sri Lanka, Malaysia, and Pakistan. In providing primary healthcare service, we follow cafeteria approach, where all Ayush systems are provided under one roof along with conventional system. Patient can choose what they want. In one of the studies that we did some time back, I have given reference of that paper. That was when we studied the situation of 40 homeopathic units working under this cafeteria approach. In this paper, we analyzed the type of population and the cost effectiveness of homeopathy in the services. And what we realized that homeopathic services were 1/5 to the cost of conventional systems. And the morbidity profile of patients were that mostly patient of skin, respiratory infections, general infection, day-to-day infection, female disorders, digestive and musculoskeletal diseases, mostly those who are having either chronic or subacute phase, they prefer homeopathy. So we analyzed through this paper about data of 2 decades. And the tangible outcome that we could see is that antibiotic resistance is a growing concern globally. If we start treating all upper respiratory tract infection and day-to-day infection with homeopathy, we can reduce the usage of antibiotics. Another thing that we realized is multimorbidity is challenging field. Homeopathy can treat these cases on standalone and adjuvant basis, wherein we can reduce the use of conventional medicine in patients. And another very important area that we saw during this analysis is that preclinical stages and cost effectiveness of homeopathy. That homeopathy is quite efficient in treating patients when there is early cases of hypertension, pre-diabetic, and hypothyroidism, early cases of hypothyroidism, and the treatment is quite cost effective. And it was also realized that the patient, those who are coming to primary health care, are quite satisfied with homeopathy. Coming to research, we have a structured system in India that is led by Central Council for Research in Homeopathy. This institution has a global vision. And our mission is to conduct scientific and ethical research in clinical practice, provide safe, quality assured and effective treatment, and provide support at global level. This institution is conducting research from multi-dimensional research activities, right? Starting from cultivation of plant to clinical trials, and also doing fundamental research. Standard treatment guidelines in different diseases are being developed. Already we have developed about 3 volumes of this, and where we have covered about 60 to 70 diseases. Our publication in basic research are there, like Brazil. During COVID care, we could especially experiment with homeopathy. Government of India laid down a narrative that if we are able to take care of normal immunity of the masses, we are going to be saved from this COVID pandemic. And that integration Ayush in COVID care was given as a policy brief at 4 levels, both at preventive and prophylactic level, treating symptomatic cases and giving add-on intervention and post-COVID management. Proper guidelines were issued and were placed on the website. General advisory was issued in respect of all the Ayush systems to the public, wherein it was advised that people can take few doses of arsenic album infrequently for saving, for getting immunity against all types of influenza-like illnesses. And it is not only that, Government of India also ensured that let everyone map out data also. And one of the publications that has come, wherein they have, through mobile app, they did cross-sectional questionnaire study to find out the usage of these systems during COVID care. And it was found that homeopathy was only after Ayurvedic system of medicine. So homeopathy has a deep-rooted presence in India. Even at Government of Delhi level, first we clinically characterized and worked out the remedy profiles of homeopathic remedies in patients of COVID-19. Then we did prognostic factor research based on this data and identified medicine as well as their prescribing indications. Since the time is short, it's not possible to discuss each paper in detail, but broadly I can tell you that we identified important medicines, and we also identified what kind of common mistakes we do in our data collection. And during the second wave, we try to overcome those mistakes. And those papers are also under publications. So friends, in India, we follow more or less what WHO says about integration of traditional medicine. And in India, homeopathy is part of traditional medicines of India. Like this graph is very common from the WHO global report, where we know that homeopathy has a presence in 100 countries. Government of India, and this presence is available almost in all continents. Considering the potential of homeopathy, international collaboration in homeopathy, Government of India during the last 5 years signed a lot of agreements. And I distinctly remember one of the agreement was signed with Federal University of Rio de Janeiro few years back. But what is the important, and we also signed with Armenia, Argentina, UK, Germany, Canada, Australia, Mexico, and even with Homeopathic Pharmacopoeia Convention of United States. So what is most important is that after signing these agreements, these institutions have to work more closely and identify projects and get funding from both sides and try to find out what best we can do. So these MOUs are just enabling instruments, but we need to work on these enabling instruments. Another important thing what we do in India is that we have regular international interactions with Liga Medicorum Homeopathic Internationalists. We have so far organized 4 international conferences in India, right starting from 1967, 77, 95, and 2011. And every year we organize World Homeopathic Day, almost a World Congress on the day of World Homeopathic Day. Homeopathy in India has a very, very strategic advantage of human resource. We have about 300,000 trained homeopathic practitioners. We have good infrastructure, legislative support, patient support, institutionalization, and Drug and Cosmetic Act support. So with this, what we look at, that medical pluralism is one of the very, very important area of providing high quality primary health care. And for that, rated in all types of traditional systems. No single system can satisfy all medical needs. And popular, traditional, and complementary health system that provide holistic, patient-centric approach of treatment should be encouraged, integrated in healthcare. There is a need to shift focus from prevention to wellness, and this from treatment to prevention and wellness. And this is what the new policy that is being adopted by Government of India is advocating. So what I feel that the countries with rich heritage of homeopathy may consider the Indian way of strategic integration of homeopathy within traditional medicine. There's a need for active and generous collaboration among researchers, professional organizations, charities, educational institutions, and drug manufacturing should be encouraged. LMHI is about 100 years old organization. And this is what this organization always try to facilitate such initiatives at institution level, at country level, and at global stage. During this pandemic, for the last 2-3 years, we could not hold our regular meetings of LMHI. So now we are, as you all know, that we are organizing an LMHI global colloquium. I will, in next 2 minutes, I will just give you an overview of this colloquium, where we stand. And India is participating in this colloquium in a big way. In this colloquium, our motto is unity, not uniformity. We attain unity only through variety. Differences must be integrated, not annihilated, not absorbed. So this is a saying of a very important management expert, and we are following for this colloquium. As you all know that this colloquium, this program is a virtual program and is going to run almost 50 hours continuously, round the clock. Most importantly, first time, this will be available in Portuguese as well as Spanish translation of the entire 50 hours of proceedings. We will be having about 5 different halls. One main hall where all the key speakers and important discussions will help, and there will be side halls where all other discussions will also, where young researchers, budding researchers can present their work and can present their posters, and we can discuss all those things under one colloquium. We are covering almost all themes of homeopathy, right? Starting from COVID-19 to how we can improve our education, practice, research, and how homeopathy can be strategically integrated in TCIM, and what kind of innovations are happening in our pharmaceuticals, and the data, big data revolution that we are now having in the world. Several 100,000 homeopathic doctors, if their data is properly monitored, managed, can we do that? And if so, how it can be, and how it can have impact on improving the quality of information that we have in homeopathy. This will be a 3-dimensional virtual conference. And along with conference, there is a possibility of participating in painting, music, dance, and photography. So it will be a very kind of a colloquium where everything under the umbrella in homeopathy will be available in one way or the other. So just I would like to conclude with the wording of our Vice President of India when he inaugurated one of our Congress in 2018, what he said about homeopathy. Are you able to listen? Is it audible?
No, it's not audible.
Okay. So what he said, that homeopathy should be there in every home. Homeopathy should become mass movement. Homeopathy is easy to administer and has no side effect, after effect, or defect. And as homeopath, you must remember that you have to practice for a mission, not for commission, and there should not be any omission from one's duties towards health or remission from basic ethics and standards of medicine and of homeopathy. It is good that homeopathic doctors are using mobile-based apps and storing and sharing their experiences globally through internet, as well as through various conferences. Homeopathy assures affordability, palatability, and compatibility with other systems of medicine. So these were the thoughts of our Vice President of India, His Excellency Venkataya Naidu ji. So friends, thank you very much for giving me this opportunity. Now, my colleague Dr. Khurana will tell us about more intricacies of research, what kind of research we are doing in India, and thereafter we'll be open for all the questions if you want to ask about Indian healthcare system, and if you want to ask about colloquium. I can tell you only one thing, that for Brazilian people, we especially made arrangement for the Portuguese translation. So it is a good opportunity where all the Brazilian students can come participate, whether they are pharmacy students or are medical doctors, all can participate in this. Everything is online. Even the poster that you are presenting here can be shared there. Thank you very much.
I hope I'm audible.
Yes, yes.
Good morning, Brazil and other participants. I think it's quite late in the evening now in India. Dr. Manchanda has given an overview of infrastructure of homeopathy and how homeopathy is being practiced in India, the kind of scenario which we have in India now. I'll be talking more specifically on biological evidence-based research. And when I talk about this, I remember an article in Lancet which was published in 2005 with a strong criticism that it was termed as equal to placebo. And that's why at that time, we in India, under Central Council for Research in Homeopathy, started working on this particular fundamental and basic research through collaborations with institutes of excellence in allied sciences. Now, there are many questions we pose ourselves on what are those unanswered questions about homeopathy, and implausibility from a scientific standpoint is often cited as a reason for skepticism about homeopathy. We posed these questions to ourselves in 2005 regarding, like, potentization, is it a demonstrable reality? How can we demonstrate what happens after potentization? What is the nature of homeopathic medicines in potentized form? And can homeopathic medicines in potencies, particularly beyond Avogadro's limit, have a biological effects? Can we reproduce them? And what are the pathways of action these homeopathic medicine, even if they have a reproducible biological effects? What do we know about the transfer of pharmacological information from the liquid form potency to the solid form pellets? And is Hahnemann theory of chronic disease valid as per the modern understanding of genomics, immunology, and other things? So we started exploring this with the first experiment on whether are there any nanoparticles available in homeopathic medicines. This was a study which was taken up with the Indian Institute of Technology in Delhi. Simultaneously, similar kind of study was also going on under Indian Institute of Technology in Bombay. And we could demonstrate that a tiny dose of homeopathic medicine has a lot of nanomaterial. This is a picture of scan electron microscopy image of colchicum 15C. And we can very well imagine that the colchicum 15C is beyond the Avogadro limit, which is not 12C. Similar kind of observations were there at study by Indian Institute of Technology, Bombay, by Dr. Chikramne, Dr. Vellare and others, which was published in Homeopathy Journal also in 2010. And they could also demonstrate the TM images of nanoparticles and aggregates of zincum metallicum, and then aurum metallicum. They did all these studies with aurum. And then we also wanted to look into other aspects of physicochemical nature of these homeopathic medicines. And this was a physicochemical study of homeopathic formulation, extremely diluted solution like of acid salicylicum in ethanol by using volumetric, acoustic, viscometric, and refractive index measurements at different kilodaltons. And we did this study in one of the university college in Delhi by Dr. Anil Khurana. He was the main scientist here. And they could also demonstrate the acoustic and different kind of properties of that solution in homeopathic form. There was a definite response at 5C, 12C, and then 18C. You can see the curve here at different density points. The sulfur samples are also measured, and you can see that there's a different, this is signature curve is coming up with the sulfur samples in 6C, 12C, 18C, 24C, and 30. Although there is a kind of a plateau after 18C dilution. And these are the ultrasonic velocity and diabatic compressibility of sulfur at different concentrations, which was measured through ultrasonic velocity parameter. And we can see that similar kind of findings we have seen here again at 6C, 12C, and then 18C. But again, there is kind of a plateauing of these kind of property after 18C potency. Another experiment we took up with another educational institute under Delhi University. Here we wanted to assess the total phenolic content of a extract from Allium cepa, the onion, very well known medicine in homeopathic side. And we could find out that at extract 1 milligram or mother tincture, they have similar kind of a phenolic content of gallic acid, which is equivalent to per gram of the sample. But if you see at 30C and 200C, the content at 200C is slightly raised in qualitative manner. And we were also amazed to find this kind of a finding where 30C, 200C, which is way beyond the dilution factor from the 30C. The amount of gallic acid is slightly more than the 30C. And this kind of finding has also been seen in the study by Dr. Bellare that they published in Homeopathic Journal. Now, these kind of physicochemical aspects of homeopathic medicines do pose certain propositions, hypothetical models, where I remember Professor Tamar Inon, he recently passed away. She recently passed away, and she described homeopathic medicine as very low molarity, repetitive succus dilute liquids. She was trying to explain the scientific part of homeopathic medicines when they are in a liquid state. And she also mentioned the nanoparticles are present in very dilute and aqueous solution, not just succus ones. Alteration of the nanoparticles by succussion. How the altered nanoparticles affect the organization of their surrounding water molecules, and how this altered organization of water molecules affects the liposomal membrane, and that the potency issue is related to the organization of the nanoparticles and their surrounding water molecules, and not specifically to their size and their penetration into the membrane. Now, these biophysical kind of a model about the alteration in the cell membrane structure by homeopathic medicine has been taken up by Dr. Papia Nandi of West Bengal. She is a renowned scientist in India. She has been working in one of the Indian Institute of Technology at Kharagpur. Now, the second aspect is whether these homeopathic medicines have specific biological effects? Do we have any evidence? So we took up these studies on with belladonna, berberis vulgaris, and many other medicines. I'm just citing two examples here. Like this was the one of the study with belladonna 200 on a suckling mice fed mothers. They evade virulent Nakayama strain of Japanese encephalitis viral infection. This was taken up first in vitro, then in vivo model also.